8th, 2025 meeting of the Senate Finance Committee will come to order. We have two bills to go through today, the first of which is Senator Herr's Omnibus Environment Bill. Senator Herr, welcome to the Finance Committee.
Thank you, Mr. Chair, members, for allowing me to bring this again to our committee on a different shape and form. The Senate File 2077 is our Environment Natural Resource Omnibus Bill. And to make things easier procedure, I'm just going to cut to the chase that after it's been brought up in this committee, we had a conversation outside and have made decision that we will remove the controversial policy and policy that has no fiscal note out of this bill. So I'm just cut to the chase to ask member to bring forward the A52 amendment.
The A52 amendment, Senator Friends offers A52 amendment. Can you explain what?
So moved, Mr. Chair.
Thank you. They are in the packets, I believe.
They should be at the back of the packet.
They're in the back of the packets. Mr. Stanley, you want to briefly speak to what this is removing?
Mr. Chair, members, I can do that. This would remove the following provisions from Article 4. Section 2 on page 104 repeals a DNR reporting requirement. Section 3, declaring the state's wild rice policy. Section 4, treating off-road vehicle trail passes the same way as snowmobile trail passes. Sections 6 and 7, authorizing the possession and importation of eviscerated carp without a permit. Section 15, authorizing the use of purple paint in lieu of trespass signs. Section 16, extending the sunset for crossbow hunting. Section 17, repealing the shotgun zone. Section 18, authorizing youth to obtain bear preference points. Section 19, authorizing the consumption of nuisance beaver. Sections 20 and 21, modifying trapping provisions. Section 22, providing for a continuous bass season. Section 23, authorizing commercial harvest of burbot on Lake Superior. Section 24, repealing recent changes to the definition of public waters. Section 25, making technical changes to the public waters inventory statute. Section 28, adding a statutory definition of commissioner to Chapter 115 of the statutes. Section 29, facilitating the use of rainwater and stormwater for outdoor purposes. Section 34, requiring local projects to address PFAS contamination to be favored for financial assistance decisions. Sections 35 through 39, exempting certain products from prohibitions on the sale of items containing lead, cadmium, and PFAS. Section 41, facilitating the use of the Clean Water Revolving Fund to pay for projects to address PFAS contamination. Section 42, making tribes eligible for community tree planting grants. Section 43, requiring metro area land use plans to address access to aggregate resources. Section 49, extending certain timber permits by 2 years. Section 50, requiring an audit of the aggregate production tax. Section 51, requiring DNR to make recommendations that facilitate local government permitting processes that adequately protect the state's aggregate resources. And Section 52, repealing some obsolete statutes. The amendment would also remove in its entirety Article 6, this is the e-waste and battery stewardship article, as well as Article 7, the environmental permitting reform article.
And Senator Herr, you said you were hoping to put these into a separate policy bill, so travel separate from this.
That is correct, Mr. Chair. Planning to schedule that on Thursday. So the policy part that Mr. Stanley just mentioned will not be terminal, but will continue on another bill.
Okay. Thank you. Is there further discussion of the A52 amendment?
Sure.
Senator Pratt.
Thank you, Mr. Chair. I just wanted to confirm, since our spreadsheets are dated 5 days ago, that all of these changes have no fiscal impact.
Mr. Mueller, go
Mr.
ahead.
Chairman and Senator Pratt, the only item that's in the amendment that deletes, it's with the e-waste part of the bill. That program is self-funding. It doesn't use any general fund. So when I go through the spreadsheet, there'll be 2 lines that talk about e-waste expenditure and e-waste revenue. Those will be, I'll note those on the spreadsheet.
Further discussion of the A52 amendment? If not, all those in favor say aye. Aye. Opposed? Motion prevails. Senator Hur, any more comments? Do you want Mr.
Yeah.
Mueller to go through the spreadsheet? Now, your choice.
Yes, Mr. Chair, before I pass it on to Mr. Mueller, I just want to walk through the bill as amended. There's 5 articles here. The first article is the balance of the environment and natural resource budget that stay within our negative $1 million general fund target. And Article 2 is the $103 million from the Environmental Natural Resource Trust Fund for 124 projects across our state that were vetted and recommended by LCCMR. And third article is the funding for the 2024 voters approved Environmental Trust Fund Community Grant. And Article 4 is a handful of bipartisan environmental policy provision that have fiscal impact or are tied to a statutory appropriation, including Senate land fee reduction for games and fish licenses for the disabled Minnesota veterans and Senator Pa's mushroom foraging task force. And Article 5, the DNR land bill. So I heard that there may be one amendment to the land bill. After I have Mr. Mueller explain into detail, we can address the amendment.
Thank you. Mr. Mueller, on the spreadsheet.
Mr. Chairman and members, I will be working off the spreadsheet that is dated 4/22 at 6:53 p.m. This spreadsheet is a change item only spreadsheet. The more detailed version that shows all the base appropriations and riders and everything is available online, or if anyone needs it, I can send that to them. Mr. Chairman and members, the general fund target that this bill has is a minus $1 million for fiscal year 26-27 and a plus $2 million for fiscal year 28-29 for the general fund. This bill does contain the governor's operating adjustments for all the agencies that were listed in the governor's budget, and I'll note those on the spreadsheet. I'll be working on the spreadsheet. Again, this is a change item only spreadsheet. I'll be working off the columns that say Senate, and I'll start going through the change items. The first is the Pollution Control Agency, and the first set of change items deal with the general fund. The lines 16 and 17 are the operating adjustments for the PCA that are funded from the general fund. It's about $446,000 dealing with the PCA and the EQB, and then about $596,000 in the tails. Next, there are some additional FTEs for permitting. This is not tied to the policy that was just deleted. These permitting FTEs were in the governor's budget and were not tied to the policy in the bill. So there's on line 18, this is for 5 FTEs initially, and then 3 in the tails. So that's about $2.7 million from the general fund and $1 million in the tails. Line 19 is a $1 million reduction to the county feedlot program. Line 20 is just a movement of money from a previous appropriation dealing with PFAS and firefighter gear. So we're moving $175,000 of a previous appropriation to the Department of Health. And we're also extending that appropriation. Line 21 and 22 are items that were in the base funded in the general fund, and this bill moves those two items on line 21 and 22 to the environmental fund. Line 23 was a rider for $7,000 a year for dealing with reporting of fish kills, and the funding for that has been deleted. Line 24, again, is another item that these recycling composting grants were funded both out of the, in the base, out of the general fund and the environmental fund, and this proposal moves it all to the environmental fund. And then line 25 is $200,000 one time for outreach activities, and there is a section in the bill that ties to this that just tells the commissioner to expand their outreach when they're working on basically all their programs dealing with the public. So the total general fund changes for the PCA is $736,000, and then minus $944 in the tails. Environmental fund changes. The environmental fund is the primary funding fund for the PCA. So you'll see the operating adjustments on line 30 and 31 much larger than they were from the general fund. So between the PCA and the EQB, it's about $8.7 million of operating adjustments in 26-27 and almost $10 million in the tails. Permitting efficiency, again on line 32, this funds 3 FTEs. Again, this is not tied to the policy that was in Article 7, but just additional FTEs that were requested in the governor's budget. So that's another $1 million per year from the environmental fund. Line 33, the air appropriation increase. This is a inflationary increase that is tied to a federal requirement that air appropriation programs must be have a inflationary increase. That's $1.9 million for the first biennium and $2.6 million in the tails, and this is also paid for by a fee increase that is also required by the federal EPA. Line 34 is a proposal for dealing with mercury skin lightening cream awareness. And there's a couple sections left in Article 4 that tie to this item, and that is $430,000 from the environmental fund and then $390 in the tails. Line 36 dealt with the old e-waste program. That's not in the bill. Line 38, 39, and 40, those were all items that were formerly funded from the general fund that are now moved to the environmental fund. The total environmental fund changes is $13.585 million in 26-27 and then $15.27 in the tails. The other funds that have a few operating adjustments on line 46, the remediation fund has about a $3 million operating adjustment and 3.3 in the tails. There was a proposal in the governor's budget from the remediation fund for additional 2 FTEs to deal with the backlog of Superfund site assessments. That's $700,000 from the remediation fund. And then on line 49 is a direct appropriation from the closed landfill investment fund. The governor's budget had proposed this being a statutory appropriation. This bill makes it a direct appropriation. The reason why it looks like new money on here is because the previous statutory appropriation had sunsetted, and so this continues the funding from the closed landfill investment program, but with a direct appropriation for 2 years at $6.5 million per year. The last one on line 50 dealt with the e-waste program. That is no longer in the bill, so that spending for the new program of $744,000 is now out. On the next page, you'll see the total spending for the PCA on line 54. The total new spending above forecast is Now just, it was 31.762, but without the e-waste now, that's right about $31 million above base. And just about a little bit less than $18 million in the tails. Again, the line 55 was the general fund amount. Again, that was 736,000 above base and then 944 below base in the tails. The fees dealing with the PCA, line 58 is the increase in the air appropriation fees. That dealt with the required inflationary increase for the spending on the air appropriation program. So that's about $1.9 million in the first biennium and 2.6 in the tails. The next two items, lines 59 and 60, will be out of the bill because that was dealing with the e-waste. Next, we go to the DNR, and we'll start with the general fund change items. On line 78, the general fund change items are 6.1 million for the 26-27 biennium and 8.2 million for the tails. And then there's also operating adjustment for the Forest Resource Council on line 79. Line 81, there is a fee increase for groundwater, for large groundwater users. And that fee, first there's a general fund reduction on line 81 that goes for the groundwater program. And that is replaced by a fee increase and new spending out of the water fee account. That's on line 103. Line 82 is a one-time $160,000 to complete the. There was in a previous bill there was some money appropriated. It was about $750,000 for a transfer of a piece of land in Mille Lacs County to the tribe, and the DNR has asked for an additional $160,000 to complete that previously authorized land swap. On line 83 deals with aquatic invasive species program. There is another fee tied to this. There's a $1.2 million general fund reduction to the AIS program. And then on line 104, the fee increase results in a $2.5 million increase to the program. So it nets out to be at about $1.3 million of new spending for the AIS program at the DNR. Line 84 is the Sustainable Foraging Task Force. There's two appropriations that deal with this. The first one on line 84 is the amount of money that is appropriated to the DNR for their work on the task force of $129,000. Line 85 is a general fund reduction dealing with private landowner technical assistance in the forestry division, and that's a $500,000 general fund reduction. On line 87 and 88, these were two appropriations that were in the 2023 bill that canceled because they did not get off the ground in time before the appropriation canceled out. So on line 87 is a $400,000 appropriation for the Silver Bay Trailhead, and line 88 for the Redhead Mountain Bike Park for $500,000. Line 89 is a reduction to the Whitetail Deer Farm Oversight Program at DNR, $500,000 per year. Line 90 is a new program for Outdoor Schools for All, and it's $500,000 the first year and then $348,000 ongoing. Line 91 is similar to what was in the PCA. It's $225,000 for outreach activities, and there's language in the bill that is tied to this. So the new general fund spending from the DNR is nets to be $680,000 in 26-27 and $1.1 million in the tails. Natural Resources Fund change items. The operating adjustment on line 101 of $8.3 million. This is spread across a number of different accounts, like the ATV accounts, the boat accounts, and parks accounts. So it's all rolled into this one line item here because all those accounts are in the Natural Resources Fund. Line 103 and 104, again, are tied to the two fee increases that are in the bill. The groundwater fee increase on line 103, that netted out to a general fund reduction in that area. And the aquatic invasive species program also, like I said, nets out part of the general fund reduction to that area. Line 106 is an increasing an appropriation from the Land and Water Conservation Fund. This is actually federal money that comes in and gets deposited into, we call it the LawCon account in the DNR, and this goes out for parks and trails. So there's a surplus in that account right now, and this just increases that appropriation. Lines 107 through 115 are all appropriations from the ATV account for different trails and programs, one-time money. So it's from the number of them go to St. Louis County on lines 108, 109, and 110, and 111. And then the line 112 is $200,000 for ATV trails in the city of Duluth. And then there's two more to St. Louis County on line 113 and 114. And then line 115 is a one-time increase to the off-highway, the ATV grant and aid program of $100,000. Line 116 is an ongoing $75,000 increase to the motorcycle grant and aid, off-highway motorcycle grant and aid program. Line 117, there is a couple sections in the bill that deal with abandoned watercraft enforcement and recovery of abandoned boats. Line 117 has an additional cost of $262,000 per year that comes out of the water rec account, and that water rec account is funded by boat fees. So the total increase on line 120 to the Natural Resources Fund is just over $20.9 million in 26-27 and $21.4 million in the tails. The last item, our last funding area for the DNR deals with the Game and Fish Fund. There's an operating adjustment on line 123 and 124 out of two different accounts within the Game and Fish Fund. So that's $1.8 million in 26-27 from the Game and Fish operating account, and then the Heritage Enhancement account is just over $500,000 for the biennium. There's one study funded by the Game and Fish Fund on line 125 that is dealing with the muskies in Leech Lake, and that's for $177,000. The total Game and Fish Fund changes is $2.5 million in 26-27 and just about $2.8 million in the tails. Last, there's an operating adjustment from the Permanent School Fund on line 132. That's $48,000 and $60 in the tails. And then the abandoned watercraft proposal, line 133 just shows the spending from any fines or when they have to sell an abandoned boat, so that just appropriates that money back out. So that's estimated to be about $50,000 per year. So the DNR change total on line 137, total across all the funds is $24.3 million, and in 26-27, and then $25.4 million in the tails, and most of that is all the operating increases. And then agency general fund change is $680,000 in 26-27, and then $1.1 million in the tails. Fee changes for the DNR are shown on lines 140 through 148. The AIS boat fee on line 144 will bring in about $2.1 million in 26 and then $4.3 million ongoing. The groundwater fee increase brings in about $2.9 million once it's fully implemented, starting in fiscal year '27. There is a change on line 146 dealing with disabled veterans fishing and hunting licenses. This brings most of those licenses down to $5. So that's a loss to the Game and Fish Fund of once it's fully implemented, $320,000 per year. And then that line 147 just captures the fee or any fines or selling of watercrafts under the abandoned watercraft proposal in the bill. So the total fees dealing with the DNR is about $9.3 million in 26-27 and $13.9 million in the tails. The rest of the spreadsheet I'll go through pretty quickly. They're just dealing with a few operating increases in some of the other agencies. Next, we have the Metro on page 4, the Metro Parks. Line 165 is just a increase from the lottery in lieu account that is dedicated just for the Metro Parks, and that goes up $250,000 per year. That's from revenues that are already deposited in that account. So the total increase to Met Council Regional Parks, there's no general fund increase. It's just $500,000 for the biennium from that lottery in lieu account. Next, we have the Minnesota Conservation Corps. There's no change to their funding. So that's $2.1 million for the biennium, and 1.16 of that is from the general fund. Next is the Board of Water and Soil Resources, or Bowser. There is an operating adjustment for Bowser on line 193, and that's $463,000 for the first biennium and $620,000 in the tails. That is the only change to Bowser. Their total funding is $63.4 million, and $32 million of that is from the general fund. Next is the Minnesota Zoo. That starts on the bottom of page 4, and the change item is on the top of page 5. There's a general fund operating adjustment for the Minnesota Zoo on line 210. That's about $1 million a year, or $1 million for the first biennium and 1.4 in the second biennium. That brings their total agency funding to $79.6 million, and 28.2 of that is general fund. The last agency here is Science Museum. There's no change to the base funding for the Science Museum. Their funding is at $2.5 million in 26-27, and also the tails. The other items I'll note on here is on line 234 is the movement of $175,000 from PCA to the Department of Health. That was $175,000 of general fund money. And that appropriation was also extended, so that's shown on line 235 and 236. The foraging task force, there's also an appropriation. That appropriation on line 238 is to the Legislative Coordinating Commission to operate the foraging task force. That's $198,000 one time. The last change item is on line 243. There was an ongoing $100,000 per year transfer from the general fund to the Metropolitan Landfill Contingency Action Trust account. And this was to pay back money that was transferred out of that account in previous budget cycles. You'll see in 24-25, there was a large deposit put back into that account of almost $27.6 million in the previous biennium. So this bill repeals the ongoing $100,000 payback going to that fund, because a vast majority of it was paid back in the previous biennium. So total spending across all the agencies and all funds under this bill on line 250, you'll see is $58 million. It'll be a little bit less than that with the repeal of the e-waste program. Be about $57.3 million, and then a little less than $47 million in the tails. And I'll just note the total operating increases in the bill were $30.5 million in 26-27 and $36.2 million in the tails. On page 6 is showing just a general fund summary of how this bill gets to the target. And you'll see on lines 256 through 266, the general fund changes for each agency. And those net out to be $2.9 million of increased general fund spending in 26-27. And then there's a one-time cancellation from the DNR of a previous appropriation dealing with seedlings that were money that was set aside during a previous bill related to drought. So that cancels $3.9 million back to the general fund. And then with the $2.9 million of new spending, that's how this bill gets to a minus $1 million target. And then in the tails, the $2 million is all nets of the new general fund spending in the bill. The total fee changes in the bill on line 289, again, the funding on line 285, the 744, that was tied to the e-waste program, so that will be coming out. So the total fee changes across all the agencies on line 289. It was 11.7 million, but now it's will be a little bit less than 11 million, and then about 16.1 million in the tails. There are a few transfers in the bill, I'll note. Line 594 and 595, this is an annual transfer of money from the environmental fund to the remediation fund, and this keeps that annual transfer at $24 million per year. Lines 596 and 597 is just moving some money from the petroleum tank fund to the environmental fund. This is tied to the operating increases. And then line 599 and 600, this is just to facilitate, is moving money from the forest suspense account to the permanent school fund. This is to facilitate the appropriations that are coming from the permanent school fund, and this just shows that money comes from the forest suspense account in order to do that. Lines 603 through 606 are just some transfers of money from previous appropriations in the PCA, dealing and moving the money from the general fund to the environmental fund so they can do some revolving loans out of those programs, and then the payments go back into those accounts. So those are just from previous appropriations in the last biennium that moved. That is it for Article 2 in the bill. I'm just going to mention the other two fiscal articles but not go through them. Articles 2, again, is the appropriations from the Environment and Natural Resources Trust Fund that were recommended by the LCCMR. These appropriations in Article 2 were previously passed by the Finance Committee in Senate File 506. So everyone has seen these appropriations previously. But I'll also note Article 3 on page 14 of the spreadsheet. As Senator Herr pointed out, Article 3 appropriates the 2 years of the community grants program. This is from the new 1.5% of the Environment Natural Resources Trust Fund that was approved in November on the constitutional amendment and of the extension for the Environment Natural Resources Trust Fund. In that bill and in that question, it added another 1.5% of the trust fund to be appropriated, and this is for that community grant program. And this appropriates 2 years of that grant program at $28.18 million per year, and this is all one-time appropriations. The last page of the spreadsheet, the Article 2 contains a number of carry-forwards that were previously, again, in Senate File 506. These are for specific projects that were in the LCCMR part of the bill, and there's about $9.1 million worth of extensions in that part of the bill. And Mr. Chairman, that completes the spreadsheet.
Thank you, Mr. Mueller. Questions from the committee on the spreadsheet? Senator Pratt.
Thank you, Mr. Chair, and Mr. Mueller, or Mr. Nauman. So if I'm looking at the 26-27, we've got $1 million reduction in forecast, but we've got $11.7 million in increased fees. So without that, we would have seen a $10.7 million increase in spending without the additional fee revenue. Is that correct?
Mr. Chairman and Senator Pratt, close to that, yes. A lot of that fee money was used to offset general fund reductions. The only area that the AIS program under the DNR did get a net increase of about $1.3 million per year with those fees. So it did cover a general fund reduction, but it did provide a net increase of new spending for the DNR for the AIS program.
Further discussion? If not, I wonder if Deputy Commissioner Meyer wants to testify. I don't know if he had requested to or not, but we allow commissioners and others to. Welcome to the committee, Assistant Commissioner Meyer.
Good morning, Mr. Chairman, members. For the record, Bob Meyer, Assistant Commissioner, Department of Natural Resources. It's a pleasure to be here today. We wanted to thank Senator Herr and the committee for the work that they've done on this bill. We appreciate the inclusion of many of the governor's budget recommendations, and I'd like to specifically thank Senator Herr for the committee and the committee on the inclusion of the DNR operating adjustment at the same overall level as the governor's recommendations. With the careful eye to the health of dedicated funds, we would like to continue to work with the Senate on potential impacts of the Game and Fish Fund balances. The governor's budget contained an operating adjustment coming out of the Heritage Enhancement Account that has been shipped to the Game and Fish Fund now. With that additional shift and spending in the bill, it puts the balance of the Game and Fish Fund at approximately hovering around 5%, which we're concerned about, which may force us to come to the legislature with a fee increase for the Game and Fish Fund in the coming biennium. We'd also like to thank the Senator and the bill for the groundwater use and aquatic invasive species surcharge increases that were contained within the governor's budget, and the inclusion of LCCMR and the community grants program that we just discussed. However, there are some concerns that the bill does not include some critical pieces of the governor's budget as follows. Proposed state park permit fee increases are omitted from the bill. These fee increases are necessary to keep pace with rising costs, and without this additional revenue, the DNR will be forced to make publicly visible reductions to state park services. Park permit fees were last increased in 2018. We'd like to work with Senator Herr and the legislature on Senate File 3307, which provides an alternative funding source to cover these reductions into the future. The bill also omits funding for legal costs, which will force costs to be paid for from programs and services in areas that are already stressed by general fund pressures. The bill also does not include funding for public safety preparedness that is necessary for our conservation officers to be able for general fund or general public safety and protection of our state assets. Furthermore, we are concerned about general fund reductions included in the bill, which include reductions to funding for private forest management work that is critical to effective forest management and climate change mitigation across the state, and reductions to the chronic wasting disease white-tailed deer farm, specifically listed on the spreadsheet, response funding that may reduce our ability to effectively mitigate the disease in working with these farms. Lastly, as mentioned, we talked about working with the legislature on the Game and Fish Fund issues and policy issues as they move forward. Thank you, Mr. Chair and members, for your support.
Thank you, Commissioner Meyer. Questions from the committee? If not, yes, Senator Dames.
Well, thank you, Mr. Chair. I don't have a question, but I do have an amendment. Is this the time to do that?
That's fine.
Thank you, Mr. Chair. And Senator Herr, I have the A50 amendment. The A50 amendment was in bill form, but the bill didn't get introduced in time before the lands bill was completed. This is, I'm bringing this on behalf of Senator Gruenhagen in Sibley County. This deals with a private sale of tax forfeited land bordering public waters in Sibley County. I understand that the lands folks agree with this, and the DNR is okay with this. Senator Herr, where are you at on this as far as this amendment?
Senator Damon, Mr. Chair, I will support it as well. I did hear that DNR is in full support of this amendment.
Senator Dames offers a 50 amendment. Is there any discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails.
And thank you, Senator Herr.
Further discussion? Senator Pratt.
Thank you, Mr. Chair. Presuming there's no other amendments, I just wanted to talk about the fact that, well, just a couple of things. You know, we had good work done on permitting reform that has been cut out of this bill, and you know, we spent a lot of time being worried about what the federal government is going to do and how it's going to impact the state, but we're not doing our part to ensure that we have a strong economy and that we're able to weather a potential recession, and permitting reform would do that. We've been talking about permitting reform. The governor has said some, you know, basically said he wants to do permitting reform, but we failed to see any action on it. I know there have been a number of bills looking at permitting reform, and continues to be one of the top issues that we hear from the private sector, and we can't seem to move forward on it. And we are losing out as a state. And then when I look at the, instead of actually cutting back, after a 40% increase in the state budget over the last 2 years, we can't actually cut any of the spending that we've done. And instead, in this bill, we're expecting Minnesotans to pay $11.7 million more in the next biennium and almost $30 million more over the next 4 years. And when we tack that on to the other shifts that we're doing, which could potentially lead to the largest property tax increase in state history, we just continue to push these bills back down on Minnesota families that are already struggling to make ends meet. And I don't know where we're going to continue to get the extra money from families that are spending you know, more on groceries, more on gas, more on, you know, mortgages are more expensive. I think we need to do a better job of looking back at what we increased over the last 2 years and pulling some of that back and realizing we probably went too far. So, Mr. Chair, with that, I'll be a no on the bill.
Thank you. Further discussion, Senator Friends.
Thank you, Mr. Chair. Senator Pratt, we've had a lot of discussion with Senator Herr, and we have his commitment to move a policy bill forward. That policy bill is going to contain the permitting language. This is what we do. We come up here and we argue about things. Senator Herr's done an excellent job with the budget part. Love to have your yes vote on the budget despite the fees. And just throwing out there that I think the permitting language is very important as well, even though I don't agree with everything that's currently in the environment policy basket. Looking forward to that work, and I think it'll be some of the most important work we do this session. So, Senator Herr, you have my support on your bill, to accompanied by your pledge that the policy will move forward hopefully Thursday. Thank you, Senator Herr. Thank you, Mr. Chair.
Senator Draheim, then Senator Jasinski.
Thank you, Chair. Thank you, Senator Herr, for your work on this. I know you've spent a lot of time and effort on it, so I appreciate that. You know, my question is the FTE count. Do you have an idea how many new FTEs we created with this bill, if any?
Mr. Mueller.
Mr. Chairman and Senator Draheim, I'll go through a couple of them here. The permitting, like at the PCA, there's about 6 new FTEs tied to permitting that is not tied to the policy. The governor just was requesting additional FTEs for permitting, just efficiency without, even before there was any policy in the bill. So there's about 6 new FTEs for that. There's 1 FTE for the mercury skin lightening program. There's 2 FTEs for the site assessment backlog at PCA. So over at PCA, that's about 11 new FTEs total. The DNR's language, there's the only major increase to spending with the DNR was dealing with the operating adjustment, so there's no new FTEs for that. So mostly the new FTEs are just tied to the PCA, dealing with permitting efficiency, site assessment backlog for Superfund sites, and then the mercury skin lightening program.
Thank you.
Senator Jasinski.
Thank you, Mr. Chair, and thank you, Senator Herr, for putting this bill together. I don't have an amendment, but I think you know what I'm going to talk about. Again, the Water Quality 3D project that we've talked about is a very successful program. The money is expired now at the end of this year. It was really kind of delayed because of a 28-inch water rainfall in the June of last year, so it made it difficult to actually get good things. Had a bill in this year and did not get included in the bill for $335,000 to continue this project. I was just at a Lake Association meeting on Sunday, just yesterday, and it was a packed house. There was people outside the doors coming in from neighboring lakes, heard about what this project is doing, and it's very, very successful. It's put on through the MPCA. I think the MPCA, if somebody's here, I hope you're listening, because it's a very important program for southern Minnesota, what it could do to our lakes and how that could clean up a lot of our lakes from the runoff and things like that. So I'm still concerned that, you know, I think there's one line item here, 63.5, there's $5.7 million going to the University of Minnesota to study aquatic invasive species. This also helps with that. So a $335,000 project out of $5.7 million could do so much good things. Again, we do a lot of studies, but this is actually a project that's in the water. The mechanical systems are in the water, and they're seeing results versus a study. So I want to continue to work with you, and you've been very gracious to work with me to do that. But I still want to keep the alert on this. And there's, you know, there was money for Fergus Falls, for Lake Alice, which is another lake that's having issues up there. Rice County, $150,000 for French Lake, and then $110,000 to Blue Earth County with North Eagle Lake that Senator Frentz is involved with as well. Thank you for your support. But again, I just want to make sure we keep this at the top of our list of things that we'd like to continue to do. It's a very, very successful thing. It takes about 2 years to actually see some progress from it, because it balances out the lake chemical balances or the pH levels the first year, and then actually you'll see really good things coming the second year, which we hope for. But now, because that money has expired, we're not going to be able to plan for the following year, and I think it's just upsetting not to see it in here. So again, I want to thank you with your work, but I really want to keep it at the top of your list of trying to get this thing done. So thank you.
Thank you, Senator Jasinski. Senator Herr, on the bill.
Thank you, member, for hearing this bill, and I also want to thank Mr. Mueller and Mr. Stanley and the rest of my staff for spending the longest time with me and making sure we have a strong budget bill, and this is a strong budget bill. As promised, the policy section of the original Omnibus bill will still carry on forward. I know permitting reform is important. Senator Hawj and Johnson Stewart have worked very, very hard at it. So, you know, I want to treasure the effort, and we're going to continue working on the policy section. It'll be a different bill. But I also want to address Senator Jasinski mentioning about the Water Quality 3D. That's a project that I approve of its pilots at the get-go. I'm the lead on it as well, and so I want to make sure that they do get funding and monitor its progress carefully throughout. I certainly, if the pilot project is accomplished and have good result, I certainly want to encourage Ramsey County or Hennepin County to be part of it as well. There's, visible lake lake deterrent, for example, like the pots and all the algae bloom are in a lake that I see all the time in Ramsey County, and I know that there's a number of elements, whether it is lawn care and such, contribute to that, but I certainly want to see the result of it, and then bring to the inner core of our city to help that out as well. But the LCCMR also an option for it. I always continue to encourage the stakeholder to look at LCCMR as an option every year. They take application before March 19, and as a matter of fact, LCCMR, which I'm a co-chair of, is happening right now, so that I can join two meetings at the same time. So I want to encourage that. I will continue to monitor the progress of water quality 3D. The staff and I worked very hard to make sure that we stay in budget with our -$1 million, and we have to be very, very creative at it. And I know members applaud me for being the bill author, but I also applaud the staffs and also the understanding of our agency, whether MPCA or DNR, and we are even created one fee that we didn't increase is the state part fee. Talk about equity and also the inflation and cost of living out there. I think from my point of view, I think part should be freely accessible to everyone, but at the same time, we need good caring, and we need to upgrade the part so that it's accommodate people of our 21st century. So we cannot do that with just air alone, or emptiness alone. We have to put some fee in it, and so I look at a more creative way, and where we cover those fee through through vehicle tag, and that's something that I'll be working with along with the transportation committee, so that it could, in the long run, I through my study, from what I learned is that in the long run, actually citizen or our state will save more if we take that approach of license plate, where they can get, where they can pay the state part fee at the DMV. So that's it. I think this is a good bill, a good budget bill, and look forward for your support.
Thank you. Senator Friends moves that Senate File 2077 as amended be recommended pass, and instruct the staff to make technical and conforming changes.
Mr. Chair?
Senator Murphy.
I'm so sorry, but could I just make one comment before we vote?
Go ahead, please.
I appreciate that. I wanted to thank Senator Herr and your committee and the staff. Sometimes people call this period of the session the season of disappointment. I also think it is a period of discernment, and I think you've used incredible discernment skills in taking apart the bill to make sure that we can move the budget. Our priority, of course, for this session is the budget, and there are some issues within the policy that need a little more work, and rather than have those run together and slow down our budget, you've made the choice to move the policy in a different direction. And while that can be disappointing for some, I think it is really important that we're focusing on the budget and making sure we're getting that across the line. So I just wanted to make sure and thank you and your committee and all of the staff for that process. Thank you.
Thank you. On Senator Friends' motion, all those in favor say aye. Aye. Opposed? No. Motion prevails. Senator Herr, thank you for the hard work on this, and we'll see the policy bill in a few days, I guess, in your committee. I'm going to suggest, because we have to change out all the packets up here and everything, that we take a brief 5 to 10 minute recess to the call of the chair until that's done. Be back soon. With that, the committee's in recess. Senate Finance Committee meeting will come back to order. We now have Senate File 2669, Senator Wiklund, the Omnibus HHS bill. And welcome to the other side of the table.
Thank you, Mr. Chair, and I'm really pleased to be able to present Senate File 2669 today, the Senate HHS Omnibus Finance and Policy Bill. Within the budget target that we were given, I needed to think about ways that we could protect Minnesotans' access to health care, given the great uncertainties at the federal level. We know as federal budget discussions have progressed, there's been a lot of discussion about whether there will be an impact to our public programs, medical assistance, and Minnesota Care. And there's just a lot of uncertainty about the effects that, the choices that they might make at the federal level could have a very devastating effect on our state budget. Certainly meeting our targets through cuts was really not a tenable option for me. Through this budget, we believe that the budget strengthens access to health care. We avoid cuts to basic coverage and continue some essential coverages that are set to expire. For example, audio-only telehealth would end this summer. Access to that is an essential benefit that we believe also contributes to cost savings for us to have our public program enrollees be able to conduct healthcare visits with providers through audio-only telehealth. The budget also innovates to address barriers that patients are experiencing in accessing the care they need. For example, there's a formulary requirement change that will allow people to access medications that they're on during their full contract year and not allow the plans to change the medication formulary level, which makes it impossible for people to continue to access a drug that they're on and that they are seeing benefits from. We also considered impacts that we're already seeing due to federal cuts and federal economic decisions, and we've taken action to increase support for food insecurity programs and for addressing homelessness programming in Minnesota. The bill also invests in key areas of concern to Minnesota families and those who work to help them. We have allocated $10 million to go towards the SSIS program that is used by child welfare workers. We have heard over and over last year and this year how essential it is to get going on replacing that system for child welfare. It's harming families and making it so difficult for caseworkers to do their jobs. We also have a small amount of funding for a fiscal analysis to understand the child welfare funding system better, so that we can make more efficient use of that funding. We have we have the governor's proposal that will address strengthening program integrity, and we have a study to look at youth programming in the children and families area. I'd like to highlight a couple provisions that I think are really would be transformative for us. Both of them have to do with medical assistance rates and increasing medical assistance rates. One was a bill I carried that would raise reimbursement rates for certain outpatient mental health and physician services in our public programs up to the Medicare level. This increase would be funded through an assessment on health insurers that is leveraged by the state to draw down new federal matching dollars. This helps our struggling healthcare providers across the state and promotes the long-term sustainability of our public healthcare programs. There is also provision that is providing a new directed payment program that addresses hospital financing via our public healthcare programs. This bill is funded by an assessment on hospitals that is used to draw down additional federal matching dollars. These dollars represent a significant boost to hospital budgets at a critical time for both inpatient and outpatient hospital services. Both of these bills together represent a historic investment in our public program infrastructure. We have known for a long time that reimbursement rates are abysmally low, and directed payment programs like these are already used across the country, so we have the opportunity right now to do something truly transformational that helps healthcare providers and fortifies access to care. This bill also contains an alternative to our existing reinsurance program, which is only funded through the end of this year. This portion of the bill, we have a 20% subsidy program that would replace our current reinsurance program with a direct subsidy for the individual insurance market. The subsidy accomplishes the same effect as reinsurance by lowering premium costs by 20%, but better targets state dollars where they are needed and untangles us from the federal waiver process that adds complexity and uncertainty to the state budget. Our budget target does not support funding the subsidy or the reinsurance program with general fund dollars, but it is critical that we find a way to maintain coverage for the thousands of people who would otherwise see premium costs rise without this support. Therefore, the subsidy program is funded through an assessment on the state's health insurance companies. Most state reinsurance programs are paid for by assessing insurance companies, so this bill proposes to fund our reinsurance alternative in the same manner. Projected state costs to fully fund the new subsidy are lower than the projected state share for reinsurance. In a way to solve our budget, meeting our budget targets, we have included a provision to restore the provider tax to 2% in this budget. As part of the budget building process, we had to take into account the target given to us and the many needs and fiscal uncertainties we have heard about over the past few months. So this bill also includes a restoration of the provider tax to its original and long-standing level of 2%. This change represents just an additional 0.2 cents per dollar, but its impact is significant, helping us maintain stability in health coverage for over 1 million Minnesotans and protecting the tremendous progress we have made in recent years. Restoring these funds maintains our fundamental commitment to healthcare access for Minnesotans. When looking across the budget as a whole, I believe all of the components of this bill work together to put forward a responsible approach to making ends meet in a challenging, uncertain time. And I won't take more time at this point to go through provisions in the bill, and I'm sure we'll have more discussion. I think the spreadsheet walkthrough will give members a better sense of all of the different provisions in the bill. But I will end my opening remarks there, and if we could take testimony from any commissioners who are present.
Sure. Thank you, Senator Wiklund. I believe Health Commissioner Cunningham is in the room, and you are welcome to the committee if you want to make a brief statement. Thank you.
Good morning. My name is Brooke Cunningham. I'm Commissioner of Health. Chair Marty, Chair Wiklund, members of the committee, I'm grateful to be before you this morning to briefly speak to this bill and to the challenges that MDH is facing. I know the budget forecast poses its own challenges, and I certainly will highlight MDH's priorities included in this bill, but I did first want to address the challenges that the federal cuts have presented to MDH. As you know, public health has historically been underfunded, under-resourced, and the investments in the past few years have shored up MDH's ability to protect, maintain, and improve the health of Minnesotans. Minnesotans have come to expect and frankly deserve a high-performing public health system. We have been able to provide that largely by winning federal grants. On March 25th, more than $220 million in previously approved federal funding was cut from MDH, which was destabilizing to the agency and the system of governmental public health in Minnesota and across the country. This was an unprecedented and unexpected action by the federal government. While these grants originated during the COVID-19 pandemic, they funded work across all of our agency, all of which had been fully approved by the federal government. This resulted in layoffs and impacts to services that Minnesotans rely on, including those that support the state's response to infectious disease, including measles, H5N1, and wastewater surveillance, the state's public health laboratory, and community engagement activities. We ended 161 grants to partners. So thank you for this bill's sustained investments in our infectious disease work. Our infectious disease teams are highly impacted because one of these grants was our epidemiology and laboratory COVID expansion grant for all of infectious disease, not COVID. Briefly, I will share with you the aims of those monies were to enhance laboratory surveillance, informatics, and other workforce capacity, to strengthen laboratory testing, to advance electronic data exchange at public health labs, to improve surveillance and reporting of electronic health data, to use laboratory data to enhance investigation, response, and prevention, and to coordinate and engage with partners. So we do very much appreciate the funding for MDH that is included in the bill, specifically for infectious disease, but as you all know, this is but a drop in the bucket compared to what was cut. As you may also know, we have a pending legal case to restore the funds, but we anticipate these cuts to be the first major cuts, not the last. And the funding that you have included reflects the need for new state investments to backfill federal resources that we anticipate will continue to be cut. Thank you also for including many of the agency's fees proposals. While they are never enjoyable to request, most of the fees in this budget have not been increased in years. Several of them have not been modified in more than a decade. Without increasing fees, we will experience delays in serving communities, performing mandatory inspections, and providing technical assistance. Together, the revenues generated from these proposals will address backlogs, help us meet public health needs, and align with the statutory required work that we do at MDH within our SGSR appropriation. And finally, I appreciate the inclusion of the operating adjustment to the Department of Health to help maintain our current service levels. This funding represents support of talented and dedicated people, investments in technology, and allows us to continue the oversight that we want for fiscal stewardship. So thank you to Chair Wiklund and your staff for your efforts in creating this bill, and thank you to the Finance Committee for your support of MDH and for public health in Minnesota. Thank you.
Thank you, Commissioner Cunningham. Did you mentioned briefly in there the cuts, and I'm just curious how many people were laid off and where. I didn't hear if you mentioned that you may have, but if so, I missed it. Could you tell me how many employees are laid off and what divisions they're in?
Yes, thank you. It's multiple divisions. These grants, again, were large monies, Chair Marty, across the whole agency, totaling more than $220 million. So immediately we had to lay off contractors, and we can get you exact numbers, certainly, but there were 50-plus contractors. And, of course, our contractors, while they have contractor in the name, they are part of our teams. We laid off more than 70 workers who, on temporary funding, were in these temporary unclassified positions. They also included student workers. And then a number of folk are sort of sitting in what a term that's being used is called purgatory. They're in a holding pattern as the legal case moves forward. So there were a lot of layoff notices issued, recognizing that we don't know where we stand yet with that federal case and their layoff and at-risk notices for another group of employees.
Thank you very much, Commissioner. We're watching with concern, but yes.
Yes.
Further, any questions from the committee? Senator Pratt.
Thank you, Mr. Chair. I don't know if I have any questions, but I thought it was interesting that the commissioner talked about how these were grants that were established during COVID era 5 years ago, and seems like we should be extremely careful about committing one-time funds or temporary funds to ongoing operations. So It'll be interesting to see how the court case turns out and whether or not those are still committed. But I do think we have to be careful about using these funds for and creating fiscal cliffs. I don't know if these employees are still needed or not, but we do have to make sure, again, we've had a massive increase in the spending budget. We've got a $3 billion structural deficit, and we are using one-time money to fund ongoing operations. It's just unsustainable.
Commissioner, go ahead.
Sure. Thank you, Chair Marty. Thank you for the comment. Certainly part of the way the public health system has been built over the decades is that we are heavily reliant and have been heavily reliant on the federal government to be a reliable partner in the space. These monies went into the space of our infectious disease work primarily, although they also affected work with community-based organizations. But when we think about our infectious disease work in Minnesota, over 90% of our infectious disease teams are funded federally. That is in part because of how the government has invested in the public health system. It's also in part because our teams have been able to add to the department's resources by winning grants, and those grants are unlikely to be available going forward. And so things like our ability to look for novel pathogens in the lab, things like when we think about the measles investigation, not only the laboratory work, but also the on-the-ground teams and communities. The same thing for H5N1. And so there is a lot of very important work for public health that we are looking at having to really scramble to cover should the federal government not continue to fund in this space.
Thank you, Commissioner. Senator Champion.
Thank you, Mr. Chair, and let me just start by thanking Commissioner Cunningham for your testimony today, and thank you for your leadership. I was just listening to the breadth of your vision and actions that you have needed to take in order to make sure that we can do the very best that we can for Minnesotans. I recognize that whenever there are grants and that there's been relying on the federal government, that we saw and have always viewed the federal government as a reliable partner, but when the reliable partner is no longer reliable, then we have to make changes and make those major decisions. So I do want to thank you for that. I thank you for clarifying that there's always been these contracts in communities and just across the spectrum, even in the laboratories, just based on, getting support from the federal government. So I just want you to know how impressed I am and thoughtful and thinking about your thoughtfulness on behalf of Minnesotans. So I know it's not easy. And one thing you did say that it made me sad, but yet true, is when you said that you think that the cuts thus far are only the beginning and not the end. And so that is where that uncertainty also lies around how deep and how severe are these cuts going to have to be, and the lives that are going to be impacted by the decisions that are not just made on a state level, but on a federal level. So let me just say that, and thank you, Mr. Chair, for allowing me to say those brief words.
Thank you very much, Commissioner. Appreciate your work and your testimony. So
Thank you.
good luck in the challenges ahead.
Thank you.
Senator Wiklund, did you want to begin with the A58 amendment?
Yes, Mr. Chair, and Senate Council will be able to walk through that. If we could get one more chair so that we can have all three of them join me at the table,
Chair, yes.
because they all have different parts. Sure. I just want to make comments, Chair Marty, Senator Pratt. I think the way that the health department is funded, I would welcome you to join us on HHS and learn more about how excuse me, funding works for the health department. But I think to, kind of, it seems like maybe they The planning wasn't done that was necessary, but I think when the federal government cuts off grants at the end of March with immediate suspension of funds, when planning was done to have those funds available for 6 to 12 months beyond what the cutoff date was, I think that our health department has been doing their part to plan for how to maintain services, and it's simply not sustainable to have immediate cuts like that and be able to respond. And as you can see from our budget, there's not a way for us to accommodate over $100 million or $200 million in cuts in trying to adjust in our budget. I am glad that we were able to fund the infectious disease prevention area to a small degree over the 2 bienniums, but it's not going to be enough to cover drastic cuts like we've already seen. So, thank you.
Thank you. So Senator Wiklund moves A58 amendment. Who's going to start? Ms. Heichel, Huffman, Leachy, or Mr. Dalla? Go ahead.
Thank you, Chair Marty and members of the committee. For the record, my name is Nolan Hudala, and I am nonpartisan Senate counsel for the HHS committee. Myself and my 2 colleagues will briefly walk through the A58 amendment, alternating based on our areas of responsibility within the HHS committee. Now, to the amendment, I would note that the page and line references that we make are to the amendment specifically and not to the underlying bill. Lines 1.2, 1.3, and 1.7 to 1.11 limit the exception from the facility fee prohibition for critical access hospitals to only unaffiliated critical access hospitals. Lines 1.4 to 1.6, 1.12 to 1.23, as well as 6.31 to 7.7, require provider-based clinics to obtain and bill using their own unique national provider identification numbers. Lines 1.24 to 6.18 impose patient notification provisions in connection with services that may incur a facility fee charge. Lines 6.19 to 6.27 clarify that the medical assistance program is not required to comply with the facility fee provisions if doing so would impact either enrollee coverage or federal funding. 6.28 makes a conforming change, and then 6.29 and 6.30 insert an effective date for purposes of those facility fee provisions.
Good morning, Mr. Chair and members. My name is Erica Heichel with Senate Counsel. So moving to lines 7.8 to 7.9, those lines make clarifying changes to a dementia services program. Lines 7.10 to 7.28 increase the testing fee for the newborn screening program to account for adding metachromatic leukodystrophy, or MLD, to the testing panel. Lines 7.29 to 8.1 make clarifying changes related to reporting EMS data. Line 8.2 is a technical change suggested by the reviser. Line 8.3 to 10.12 adds sections modifying portions of the medication repository program. Line 10.13 to 12.6 add language to conform with the spreadsheet related to a fee increase on county-based purchasing plans. Line 12.7 to 12.19. This section is from the governor's budget bill and modifies fees for licensed manufactured home parks and recreational camping areas. Line 12.20 to 12.22 make clarifying changes to a section establishing a spoken language healthcare interpreter work group. Line 12.23 to 13.1 make clarifying changes to a section establishing an ambulance operating deficit grant program. And line 13.2 is a technical change suggested by the reviser.
Line 13.3 corrects an erroneous cross-reference. 13.4, 13.13 to 13.21. Those lines clarify that the rate increase for inpatient behavioral health services as well as master's level mental health services are funded by the MCO assessment in the bill. Lines 13.5 and 13.6 make a technical change suggested by the reviser. 13.7 to 13.10 insert a missing effective date for provisions increasing rates for services provided in birth centers. Line 13.11 clarifies the rate increase for phototherapy services only applies to services provided to newborns. And line 13.12 clarifies that the MCO assessment is not required to equal 2.8% of health plan company gross revenue annually, and that amount cannot exceed 2.8% of those revenues.
Mr. Chair, members of the committee, for the record, Allie Hoffman-Litchie with Senate Counsel for HHS. Lines 13.22 to 21.28. This moves provisions related to complex PTSD from the behavioral health policy article to the behavioral health finance article due to them having a cost. Lines 21.29 to 21.30. These are technical changes suggested by the reviser. Line 21.31 is a technical correction to update a cross-reference. Lines 22.1 to 22.5 again deletes a section related to the complex PTSD from the behavioral health policy article and moves it to the finance article. Lines 22.6 to 22.9 makes clarifying changes. 22.10 is the last section that gets deleted and moved related to the complex PTSD. Line 22.11 deletes a section related to an online behavioral health locator that's being taken care of in the appropriations article. Lines 22.12 to 22.15 are technical changes identified by council. 22.16 to 22.23 deletes and reinserts language related to 2-year disqualifications for background studies due to it just being drafted to the wrong section of statute. 22.24 to 22.26 are additional technical changes. 22.27 is a Department of Human Services recommended change. 22.8 is a technical change. Point 28 is a technical change identified by council. 23.1 to 23.20 are technical and clarifying changes related to the Prepared Meals Grant Program language. 23.21 to 24.7 are technical and clarifying changes to the Regional Food Banks Grant Program language. 24.8 to 24.29 are the Department of Children, Youth, and Families recommended changes to the relative foster care licensing provisions, including adding effective dates. 25.1 to 25.2 and 25.11 are just technical changes identified by council. 25.3 to 25.9 is adding a section that was previously missed. 25.10, 25.12, and 25.16 are deleting sections as recommended by the Department of Children, Youth, and Families. They are intertwined with other sections that were not heard in judiciary, and so they just need to be removed. 25.13 to 25.21 are technical changes that are identified by council and also an effective date requested by the Department of Children, Youth, and Families. 25.22 to 27.9 are moving sections from the Children and Families Licensing Policy article into the Early Care and Learning Finance article that relate to reconsideration orders due to this having a cost. 27.10 to 27.11 is just a Department of Children, Youth, and Families recommended change. 27.12 to 27.17 is adding a section related to the Department of Children, Youth, and Families recodification cleanup bill. 27.19 to 29.6 are additionally, they're moving sections from the Children and Families Licensing Policy article to the Early Care and Learning Finance article. These relate to reconsideration orders and family child care modernization. And then this also deletes them from the article. Lines 29.7 to 29.20 are clarifying changes to sections establishing requirements for green burials. Lines 29.21 to 30.21 adds a new section that directs the Commissioners of Health, Human Services, and Children, Youth, and Families to provide a report on their grants. And then lines 30.22 through the end, so 66.1. This deletes the appropriations articles and reinserts them with conforming changes to match the spreadsheet.
Thank you to the three of you. Discussion on the amendment. If not, Senator Howell.
Thank you, Mr. Chair. And can someone explain to me, there was a whole host of discussion about the PTSD revisions. What effects does that really have on the care that folks that are suffering with PTSD, what they actually receive in care?
Mr. Chair, Senator Howe, this is a language that was brought forward in a bill that it has to do with MA coverage for targeted case management. And in the past, PTSD and complex PTSD, I believe, were not included. And so this makes it possible for those to be included and covered under this MA medical assistance service.
Senator Draheim.
Thank you, Chair. My question has to do, I saw a couple expiration of uncodified language. Can you explain why those provisions are in there? I didn't hear anybody talk about that in the recap. 60.21 and a few pages prior to that, I don't.
Mr. Chair, Senator Draheim, this is, assuming part of the appropriations articles for the HHS committee, this is language that's always included in the Health and Human Services appropriations article. I don't really have, unless Mr. Vessel wants to come up and explain why it's needed, but these are always found in the HHS appropriations.
Senator Draheim.
I guess my question would be why is there just a couple and not for all of the funding? Doesn't that allow the agencies to be able to move money around?
Mr. Vessel. Mr. Vessel, welcome to the committee.
Good morning, Mr. Chair and Senator Draheim. If you're asking specifically about the section at the end of each appropriations article, is that right?
Section 25, 40.9 is the first one, I think.
Mr. Chair and Senator Draheim, those provisions in the Human Services Bill have, as Ms. Hoffman-Litchie said, they have been there for many years, beginning in the 90s. They do not necessarily allow the agencies to move money around. What they do is they have the effect of eliminating any rider restrictions or temporary provisions relating to appropriations in this particular bill, so that they do not last beyond the biennium in which they were appropriated.
Senator Draheim.
I'm good, thank you.
Further discussion of the A58 amendment? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. We going to move to the spreadsheet now?
Sure.
Mr. Vessel, thank you all. Mr. Vessel, welcome to the, go to the spreadsheet now. Yes.
Mr. Chair and members, to begin on our spreadsheet, the columns on the right-hand side are the Senate's position, and then the columns in the middle are the governor's proposals. As a general rule, if the Senate has not picked up a governor's proposal, I just kind of gloss over them. There are a couple of exceptions to that this time around. The target information is on line 11, showing the bill in the first biennium uses 3 fiscal years to achieve the targets 25, 26, and 27, and then the amount is there also for 28 and 29. The amounts in the bill in other funds than the general fund are listed on lines 14 to 20. The next section is the Healthcare Access Fund, lines 25 to 33, and that shows that the Senate's balance in the Healthcare Access Fund is $141.8 million at the end of fiscal year 2029. Similar sections on lines 35 to 39 track the balance in the TANF Fund, and the Senate's balance is $3.3 million. Lines 41 to 48 track the changes in the medical assistance program by eligibility category, if that interests you. Beginning on line 50 and through near the bottom of page 2 are the summaries of appropriations by fund for each of the agencies in this jurisdiction. The first change item is on the bottom of page 2 on line 145, and that is the operating adjustment for the Department of Human Services, and that's $13.3 million in the first biennium and $17.8 in the second. The next change is on page 3. It's on line 155, and that's Senate File 2043 and 2743 rather, and also a governor's proposal that Senator Wiklund mentioned to extend audio-only telehealth services. That has a cost of $18.9 million in the first biennium and $1.8 million in the second. The next change is on line 167. This is a governor's proposal to provide sustainable funding to access federal data sources. That's $7.2 million in the first biennium and $10.1 in the second. The next one is also a governor's proposal on line 171. This is to dealing with housing stabilization to provide additional funding to process applications under that program. And it's $561,000 in the first biennium and $600 in the second. Line 176 is a governor's proposal relating to detecting, preventing fraud, waste, and abuse. The Senate fully funds the proposal just in a different way than the governor does, which is why the amounts are different. Actually, that's not true. I apologize. The Senate's numbers reflect a correction to the governor's position that came to us from the agency. There were some calculations that were incorrect, but because they didn't come from MMB, we did not change the governor's amounts. The next change is on page 4. It's on line 197. This is the governor's proposal relating to background studies and disqualifications, and that funding is $512,000 in the first biennium and $508 in the second. The Senate includes on line 203 the governor's recommended updates to the FQHC rate methodology. Line 205 is the governor's recommendation to relating to the drug formulary review committee. The governor sunset it, the Senate delays it, but the savings are the same of $37.9 million in the tails only. The next few proposals are governor's proposals that the Senate did not pick up. So the next change item is on page 5, and it's on line 235, and this is to eliminate a contract for the drug effectiveness review project that saves $95,000 per year ongoing. Line 239 is a governor's proposal relating to background studies to comply with federal requirements, and that is $219,000 in the first biennium and $192,000 in the second. Line 243 is a governor's proposal to provide for direct payments for the adult mental health initiatives and traditional healing grants, and the Senate picks that proposal up. Line 245 is a series of governor-recommended technical changes to the budget structure of the Department of Human Services, It has no dollar effect, but puts the amounts of money in the budget activities that the agency desires for setting up its budget since the Department of Children, Youth, and Families items were moved. Line 260 is the Healthcare Access Fund appropriation for medical assistance. The Senate has a number of changes in that line that net out to a change between the Healthcare Access Fund and the General Fund of $317.4 million in the first biennium and $283.5 million in the second. Line 266 is the governor's proposal to cancel and reappropriate money for child welfare IT. This cancels in one agency and is reappropriated in a different agency, so you will see this item later. Line 270 is a series of unexpended grant balance cancellations, and you can see the list of them on page 6. The governor has one, the Senate has several more. Together in the Senate, over both the General Fund and the Healthcare Access Fund, they are $15.7 million in fiscal year 2025. On page 6, we begin a number of Senate proposals. The first one is on line 282. It's Senate File 1113, Senator McQuaid's bill to provide for MA coverage for birth services provided at home. That has a cost of $43,000 in 26-27 and $14,000 in the second biennium. Line 286 is Senate File 1561. This is a Senator Mann's bill relating to PRTF payment methodology and a report, and that's a one-time cost of $196,000. Line 291 is from the same bill of Senator Mann's. This is a grant to the Mental Health Collaboration Hub for a pilot program, a one-time funding of $776,000. Also from a Senator Mann bill, Senate File 1953, are grants for early episode of bipolar disorder, and that's $125,000 each year ongoing. On line 301 is Senate File 928, a Senator Mann bill. This one relates to school-linked behavioral health grants, and the Senate cancels a one-time appropriation of $3 million and then smooths that out over the next 4 years to eliminate a funding cliff. So that turns into $750,000 per year of ongoing funding. On line 305 is another one from Senate File 928. And this is a change to the mental health targeted case management rate for individuals 18 to 21 years old. And that is $617,000 in the first biennium and $733,000 in the second. Line 310 at the very bottom of that page is Senate File 1732. That's a Senator Bolden bill for a family supportive housing grant program, and it's one-time funding of $750,000. On the next page, page 7, on line 316, is a Senator Kupek bill, Senate File 2022. This is for a grant to Clay County for a PRTF facility renovation project. It has two parts. One is for a planning grant, and one is to renovate the facility. You can see that in sort of the detail tracking below the top line. It does use a $200,000 cancellation in fiscal year 2025 for the startup grant portion. The total is $1.2 million in the first biennium. On line 324 is Senate File 1162, Senator Zhang's bill. This is a grant to Catholic Charities for the Homeless Elders Program. It's $1 million in the first biennium, one-time funding. Line 330 is Senate File 1385, a Senator Dibble bill that provides grants to community-based HIV AIDS support services providers, and that's $4.5 million per year ongoing. On line 2152 is a Senator Mann bill that provides for a directed payment for pharmacies in the form of a dispensing fee, and that is $12.8 million in the first biennium. And where that bill ends, the next one on line 342 picks up, and that is also a Senator Mann bill, and it would establish a state pharmacy benefit manager for MA and Minnesota Care. That has the result over the Healthcare Access Fund and the General Fund of reducing spending by $959,000 in the first biennium and $23.4 million in the second. On page 8, on line 354, is Senate File 1806. This is a Senator Mann bill that makes changes for health insurance formulary, health insurance plan formularies, and that has a cost of $5 million in the first biennium and $7 million in the second. On line 364 is Senate File 1497. This is a Senator Utke bill providing for MA coverage for long-term electrocardiogram monitoring, and that has a cost of $25,000 in the first biennium and $41,000 in the second. Line 372 is reflects information that Senator Wiklund received while putting together the budget, that the state currently does not receive an available enhanced federal match for expenditures for family planning services. And with some changes to the agency's computer systems, we would be able to obtain that enhanced rate. And this is the savings that would result from that of $10.2 million in the first biennium and $15.4 in the second. Line 377 is a Senator Hochschild bill, Senate File 1861, relating to licensing changes for specified swing beds, and that has $183,000 savings in the first biennium and $286,000 in the second. Line 382 is Senate File 2670, a Senator May Quaid bill. This reflects a payment rate change for phototherapy lights for newborns, and that's $18,000 in both biennia. The next one is Senate File 1054 on line 386. It's a health plan coverage requirement for vasectomies. That is in the bill and does not have costs for MA programs. Line 388 is Senate File 1953. This is the MA case management coverage for PTSD and CPTSD, and that is $2.6 million in the first biennium and $4.6 million in the second. The next change is at the top of page 9. It's Senate File 2109, a Senator Pappas bill providing for rate changes for birth centers, and that carries a cost of $452,000 in the first biennium and $644,000 in the second. Line 398 is a trend reduction for the managed care capitation payments, and that is a 0.35% reduction in the assumed growth of those payments, which results in savings of $27.2 million in the first biennium and $58.3 in the second. Line 402 is Senate File 2413. This is Senator Mann's bill that includes a directed payments for hospitals and an increase in the hospital surcharge. And you can see if you look at the lines below the top line, so the top line clearly nets out to zero, but that includes payments On line 404, some admin costs on those lines 405 to 408, or 7 rather, and then revenue in the form of an increase in the hospital surcharge that covers the cost so that the effect on the state treasury is neutral. The next one is structured similarly. It is Senate File 1402, a Senator Wiklund bill, and Senate File 1326. And this one provides for provider rate increases in the MA program, and then directed payments to accommodate those rate increases for the managed care organization payments, and an assessment on managed care organizations that is equal to the expenditures under the bill. I would point out that on line 421, this is related to a Senate House Child bill. I think it's Senate File 1860. 1080. And later you'll see one-time funding in the first year of the biennium of $18 million for the ambulance provider operating deficit program. This line here, line 421, would make that amount of money ongoing. And then on line 422 is the
Excuse me
amount.
for a second. Senator Pratt has a question.
Thank you, Mr. Chair, Mr. Albrecht. As I'm following through the spreadsheet, I've seen a couple of times so we've got the Healthcare Access Fund as the source of funds. We've got ED, AD, and FC. I'm wondering if you can just explain what those sub-funds or subdivisions are.
Mr. Chair and Senator Pratt, on the very first page when I pointed out that the spreadsheet tracks the eligibility categories, ED is elderly and disabled, AD is adults without children, and FC is families with children.
Thank you.
Please proceed.
Okay, so the next one is at the bottom of that page. This is on line 425. This is a provision that was done in the tax committee modifying the definition of gross revenue for prescription, relating to prescription drug rebates. That has the effect of putting additional revenue in the Healthcare Access Fund for the provider tax of $26.6 million in the first biennium and $33.4 in the second. And then at the top of page 10 on line 430, Senator Wiklund mentioned this in her remarks, is to restore the provider tax to the 2% level. And that has non-dedicated revenue in the Healthcare Access Fund of $181.2 million in the first biennium and $220.1 in the second. That, Mr. Chair, is the end of the Department of Human Services. Moving into Department of Children, Youth, and Families. The first one is line 441. This is the governor's recommended operating adjustment of $6.2 million in the first biennium and $8.3 in the second. Line 446 is a series of changes to comply with federal requirements, and they are together $14 million in the first biennium and $20.4 million in the second. On line 453 is the governor's recommended electronic statewide attendance tracking for child care attendance. And for the Senate, that is $5.4 million in 26-27 and $3.3 million in the second biennium. Line 460 is the reappropriation of the child welfare IT modernization money that I mentioned earlier. That's $10 million one time. Line 464 is a governor's proposal to add additional staff to their the department's compliance team. That's $489,000 in the first biennium and $532 in the second. On line 469 is the governor's proposal relating to transition office funding for DCYF it's a cancellation of $8.5 million. The governor reappropriates a portion of that, and the Senate does not. On line 475 is the governor's proposal that would cancel funding for a couple of child welfare initiatives for the Mille Lacs and Ojibwe, who don't want to pursue those changes any longer. And that's $7.9 million per year of ongoing funding. On line 479 is the governor's proposal to reduce funding for the Restorative Practices Initiative grants, and that's $1.5 million per year ongoing. The proposal on line 483, the Senate does not pick up. That proposal would take nearly $130 million per year and transfer it out of the general fund into a special revenue into the special revenue fund in a dedicated account. Line 491 is a governor's proposal relating to grant reporting requirements for the Indian Child Welfare Act and eliminating a cap on what are called the special focus grants. The Senate includes that. Similarly, so members, these hash marks indicate things that in the budget that would affect the way money is spent but don't cost money. Line 493 is another one of those that would expand the public-private permanency collaboration services to include kinship-related services, and then finally modifications to the TEACH scholarship program to bring the state program into alignment with the federal program. National program, I should say. And then on line 497 is a governor's proposal relating to the licensing information lookup for child care licenses, and that's one-time funding of $200,000. Moving into Senate proposals on line 502 is a Senator Bolden bill, Senate File 1348, additional funding for regional food banks of $6 million. One time on line 508, Senate File 1112, additional funding for food shelves of $4 million one time. On the next page, on line 512, is additional funding for prepared meals, food relief. That's Senate File 1412, a Senator Kupek bill of one-time funding of $2 million. Line 518 is Senate File 2042, a Senator Wiklund bill for a report on out-of-school and youth programming for $273,000. Line 523 is Senate File 1897, a Senator Kupek bill providing for the Child Care Improvement Grant Program, $2 million one-time funding. Line 527 is Senate File 1898, a Senator Kunis bill that includes a child welfare fiscal analysis, and that's $382,000 one time. Line 533 is Senate File 328, a Senator Putnam bill for a grant to the St. Cloud Area School District for the Preschool for Success program. That's one-time funding of $307,000. Line 539 is Senate File 1232. This is a Senator Wiklund bill that includes a variety of child care provider regulatory changes, and that's $1.9 million in the first biennium and $1.7 million in the second. Line 544 is a proposal that allocates certain TANF eligible expenditures from the general fund to the TANF fund, and that is reduces general fund spending by $4 million per year ongoing. Line 550 is a governor's proposal relating to moving some funding for early literacy programs from the Department of Children, Youth, and Families to the Department of Education. And Mr. Chair, that's the end of the Department of Children, Youth, and Families. Next, we move to the Department of Health. Line 589 is the governor's proposal relating to infectious disease prevention, early detection, and outbreak responses, and that's $1.3 million ongoing. Line 593 is the operating adjustment for MDH, $7.3 million over the general fund and healthcare access fund in the first biennium and $9.8 million in the second. These next four items, again, relate to how money is spent rather than spending money. The first one is on line 599 to reauthorize the State Trauma Advisory Council. On line 601 is changing the American Indian Health Special Emphasis Grants from competitive grants to a formula distribution. Line 603 is repealing a sunset for the Newborn Hearing Screening Advisory Committee. And on line 605 is a change to clarify that the Maternal and Child Health Advisory Task Force is an advisory committee. Line 607 moves $2.5 million per year ongoing between a couple of different cannabis-related grants. Line 616 reduces funding in the tails for activities that were funded ongoing but were one-time activities relating to maternal and child health grants with the cannabis funding. On line 632 is the first of the Senate proposals. This one is Senator Umu Verbatim's bill that prohibits facility fees and has funding of $564,000 in the first biennium and $736,000 in the second. Line 636 is Senate File 509, Senator Mann's bill to reflecting licensing requirements for graduates of foreign medical schools, and that has ongoing funding of $9,000 per year for administration. Line 640 is Senate File 1534, Senator Bolden's bill relating to speech language pathology assistance and providing one-time funding to reduce the fee for those licensees. Line 644 is Senate File 1538, a Senator Bolden bill that relates to epilepsy and seizure disorders, data collection, and a state coordination plan. That's $378,000 in the first biennium and $432,000 in the second. Line 648 is Senate File 831, Senator Bolden's bill for a grant to the Minnesota Medical Association for the Treat Yourself First campaign, and that's $250,000 of one-time funding. Line 653 is Senate File 1030, Senator Mann's bill to set up a dementia services program, and that's $217,000 per year ongoing. Line 657 is Senate File 1691, a Senator Champion bill for a grant to the Birth Justice Collaborative for the African American focused home place program, $500,000 of one-time funding. Line 662 on page 15 is Senate File 1858. And this would transfer the Healthy Eating Here at Home program from the Humanities Center to the Department of Health, along with all of its funding. The next several proposals, with the exception of line 669 of the governor's proposal to align the collection of the statewide hospitality fee, the Senate does not pick that up. The rest of these are all the governor's fee increases that the commissioner mentioned. I'll go through them quickly. It's food, pools, and lodging licenses, engineering plan review fees, public water supply fees, that's on line 676. The well management fee, line 685 is the radioactive materials fee. 690 is asbestos abatement projects. Line 695 is HMO regulation. On the next page, line 699 is X-ray radiation inspection fees. The Senate does not pick up the healthcare licensing one. On line 709, is Senator Wiklund, Senate File 2043, that deals with the spoken language healthcare interpreter work group, and that's a $235,000 one-time appropriation. And line 714 is Senate File 1494. This is Senator Miller's bill relating to newborn screening for metachromatic leukodystrophy, MLD, and that increases the newborn screening fee with the amounts shown on line 717. The next section is the health-related boards. Generally, these are governor's recommendations. I'll go through them quickly. On line 721 is behavioral health and therapy. This one has a fee increase and additional staff funding. The Board of Chiropractors has a fee increase and an operating adjustment. The Board of Dentistry has just additional funding for staff. The Board of Dietetics and Nutrition Practice has an operating adjustment. The Board of Medical Practice has at the top of the next page, Senate File 509, Senator Mann's bill relating to the graduates of foreign medical schools. The Board of Nursing has Senate File 832, Senator Bolden's bill for certified midwife licensure. Line 758 is the Board of Occupational Therapy Practice, has Senator Kupek, Senate File 2571. Which
one? The occupational therapy?
Yeah.
I think it's occupational therapist.
That relates to licensure of occupational therapists. The Board of Pharmacy has a collection of things, including the governor's recommendations near the bottom there. The first two lines in the general fund are the governor's recommendation to extend an appropriation, includes the governor's operating adjustment. Then in the middle there, we have Senator Mann's Senate File 1785, relating to the prescription drug repository, allowing that entity to purchase prescription drugs, and Senate File 3121, which is Senator Kupek's bill relating to pharmacy interns licensure. The Board of Podiatric Medicine has a fee increase. The Board of Social Work has a fee, establishing a new fee for the Interstate Compact. And the Board of Veterinary Medicine has a fee increase and additional funding for staff. On the next page, these are the other agencies in this jurisdiction. The first one is at the top of page 18. This is the Office of Emergency Medical Services that picks up the governor's recommended operating adjustment. Line 823 is a governor's recommendation, but is also Senator 2499. Senator Mohammed bill that allows for individual sharing individual location data with public health agencies. Line 1080 is Senator Hauschild's bill for the ambulance providers operating deficit grant program. This is the one-time funding I mentioned earlier. Senate File 1132 is a Senator Hoffman bill for an ambulance service training and staffing grant program. And Senate File 1133 is also a Senator Hoffman bill providing for education reimbursement. The Ombudsperson for Families has an operating adjustment. The Ombudsperson for American Indian Families has an operating adjustment. The Rare Disease Advisory Council on line 836 has an operating adjustment, and also Senate File 2037, Senator Bolden's bill that provides additional base funding ongoing. Line 841 is the Ombudsperson for Foster Youth, which has the governor's operating adjustment, and Senator Kunish's Senate File 1547 that provides additional funding for the base ongoing. On the next three lines, 846 for Minsure, 852 for Commerce, and 857 for MMB. These all have different components of Senate File 1024. Senator Wiklund's bill, that is the health insurance premium subsidy. Minsure's role in that is really minimal. At this point, the Department of Commerce receives the assessment revenue, and the Department of MMB makes the payments to the health plans. And currently, we're showing the Minsure's costs under MMB. Presumably, they would achieve that through an interagency agreement. The Department of Education, I believe, is last, and this is the other half of that proposal of the governor's to move some funding for early childhood literacy grants from DCYF to the Department of Education.
We are going to recess at this point. Are there any real quick questions about spreadsheet right now? If not, we'll take them later when we reconvene. If not, very long spreadsheet. Thank you for your good work going through this. We are going to recess for caucuses and floor session, and then we'll come back later today to continue with your bill. And with that, this committee is in recess to the call of the chair.